The Honourable Leader of the New Democratic Party.
Thank you. Mr. Speaker, I'd like to talk about Evelyn Hornbeck. I'd like to ask the Premier about Evelyn Hornbeck. She's one of the thousands of Nova Scotians who don't have access to primary care. She relies on a controlled prescription that she can't get at a walk-in or a pharmacy. She needs primary care, but she has no idea when she will get it. Meanwhile, the Premier has provided no details about the future of primary care. What is it going to look like? In a global supply shortage of doctors and nurses with over 100,000 Nova Scotians on the list for primary care, the Premier can call doctors all day long, but people will still be waiting. And so my question is a simple one, Mr. Speaker. How long do Nova Scotians have to wait for access to primary care?
The Honourable Premier.
I guess, Mr. Speaker, what I would say is, you know, we inherited a situation it's going to take some time to fix it. I've been very, very clear with Nova Scotians on that. But guess what, Mr. Speaker? As well as it will take time and money, which I've always been very open with, which is hard for people to accept from a politician, but I've been very open and clear. And what I would tell the member is we have taken a number of steps. The expansion of virtual care, offering jobs to every nursing graduate, 200 more nursing seats. Ask a CCA if we've addressed the affordability issue. The steps we have taken in healthcare will take time, but I want to assure the member, we had to get the soil ready, and the soil was pretty hard after 8 years of neglect. Then we had to plant some seeds. The seeds are being watered, and they will grow, but we have planted an incredible amount of seeds to improve healthcare in this province.
The Honourable Leader of the New Democratic Party on her first supplementary. Order, please. The Honourable Leader of the New Democratic Party has the floor.
We'll turn away from gardening and back to health care, and I'll ask Mr. Speaker about Vicki Gray. Vicki Gray turned to social media recently to share her frustrations. She had to close her small business while she waits for surgery. Meanwhile, her doctor has advised her not to use her wrist. She can't turn a key, grip a doorknob, type, lift. Wait times for her surgery in Antigonish are close to 2 years. In Halifax, she was told it would be closer to 3. There are thousands of people in this province in Vicki's situation, Mr. Speaker, in pain with their lives on hold. And so I will ask the Premier again, how long do Nova Scotians have to wait for decent access to the health care they deserve?
The Honourable Premier.
Thank you, Mr. Speaker. And of course, there are challenges. Nobody will deny the challenges. There's also lots of good that's happening, Mr. Speaker. There's a surgery wait list, yes. But just yesterday, hundreds of surgery happened across this province, Mr. Speaker. Yes, there are issues in the emergency room, but just yesterday, 2,000 people were seen in emergency. There are things happening, and the opposition wants Nova Scotians to be fearful of what's happening in the healthcare system. But I will assure you, Mr. Speaker, Nova Scotians know one thing, and they have confidence in one thing. This is the government that is getting things done.
The Honourable Leader of the New Democratic Party on her final supplementary.
Mr. Speaker, healthcare for Nova Scotians has become less accountable, less accessible, and more precarious by every measure over the past year. Spencer Thomas's 4-year-old recently became ill with a fever and a rash. The family tried 6 different walk-ins to try to see a doctor. They failed. They then went to 6 different pharmacies to try to find medication. They never did see a doctor in Nova Scotia, Mr. Speaker, but they finally got a diagnosis at a walk-in in Ontario where they went on a pre-planned family trip. Mr. Speaker, Vicki, Evelyn, Spencer, his family, and thousands of other Nova Scotians are quite literally getting sick of waiting for things to get better. I would like to ask the Premier one last time, how long will they have to wait until they have access to basic health care?
The Honourable Premier.
Mr. Speaker, I mean, these tragic stories that touch us all for sure is what drive us as a government. They're the reason we're pushing forward. And I guess what I would say to the member and the Nova Scotians reference is I want them to know how much work is happening, how hard the government is working. There's no overnight solution. You know, there's no magic wand. We've always been very honest with that. And the direct answer to the question of how long is that shorter than if that government was still in power, Mr. Speaker.